Nicaragua, which is a developing country in Middle America between Pacific and the Caribbean Sea. This country is suffering by various health issues. We will base on social, cultural, and environmental factors to search the health issues of people, specific focus on children and women. The three main public health issues in Nicaragua are health system, the interplay of women's maternal care with child health and mental disorder. In Nicaragua, the government aims to provide free healthcare services while they lack the resources and financing needs. The health professionals can only receive standardized and very limited salary. Furthermore, the clinics usually lack basic infrastructure needs, and the volunteers often receive very limited training and do not get monitored or evaluated. The pregnant women have very limited autonomy in Nicaragua. In rural areas, intimate partner violence and violence against women is very common, especially during critical periods of women's pregnancy. For children, because mothers usually are not educated, they may not seek enough health care for their children. Because the mental health care and education in Nicaragua is very limited, teenager suicide rate is the highest in Latin American region, and it is nearly double the average. As for some recommendations to get this project underway, we propose, for starters, that more hygiene and environmental consciousness education be accessible to the public. Any investments provided will be focused on those at greatest risk, including poor urban and rural programs and families in greatest need. For maternal and mental health, we also recommend more widespread education and more trained professionals and volunteers. For maternal health in particular, birth control, contraceptives, and couples counseling options need to be readily available. The mental health department in general requires far more expenditure. It needs more trained professionals, buildings, awareness of problems, and providing assistance in schools. According to the recommendations, we made a more detailed plan and briefly calculated some of the budget. First, we want to ensure one available quality clinic per 100,000 population. Government investment in basic infrastructure and human resources over a period of 6 years. The expected expenditure would be 6 million over 6 years. Second, we want to ensure at least 10 trained professionals in maternal care per 50,000 pregnant women. And we need at least 30 volunteers trained under the guidance of WHO and UNICEF to give free educational seminars to mothers every 4 months. Third, a psychiatric hospital with 1 trained professional per 4 patients is highly recommended. Staff of 50 in total, with about 20 doctors and 30 assisting nurses. The expected investment would be $4 million over 3 years. Fourth, investment in sanitary latrines and water resources is essential. We recommend to give cheap water filtration devices to families that collect water from wells. Also, sanitation and hygiene should be part of school curriculum. These interventions are designed keeping in mind the overall goal of creating a sustainably healthy population in Nicaragua and reducing the burden of disease. The intervention addresses both an immediate source of treatment as well as long-term health practice to change and reduce the onset of new or re-emerging diseases. The aim is to provide Nicaragua the resources to sustain their own health and not be dependent on the healthcare system to achieve and keep their better health.